I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and the Director of Training for the Gorski Synapse Corporation. This week I'm in Salt Lake City conducting a 5-day relapse prevention counseling school for the students at the University of Utah's 61st Annual Alcoholism and Other Drug Dependency School. Today, as I was working with the students, a number of them were sharing about some of the patients they've been working with who had years in recovery and relapsed over inappropriate medication use for chronic pain conditions. And this is so unnecessary because just because someone's in recovery doesn't mean they have to suffer with pain. And one of the things I like to help participants learn in my trainings is that there are resources. There are a lot of resources so people no longer have to suffer with a chronic pain condition. For people in recovery, they need to have an appropriate and monitored medication management plan in place with people on their team who can help support them in using the medication effectively and make sure it's prescribed by people who know what they're doing, that understand the dynamics of addiction, recovery, and relapse. Because if they don't have that, they are doomed for a relapse episode. And as I often tell my students, anybody in recovery has another relapse episode left in them, but they don't know if they'll have another recovery attempt. A lot of people living with chronic pain develop an addictive disorder also. And this is also unnecessary if they follow the right treatment protocols. That's why I highlight a whole chapter in my new book, Freedom from Suffering, A Journey of Hope, on how to make healthy decisions about medication management and see what's right and what's not right for the individual. I believe that freedom from suffering is everyone's right, and I also believe it's their responsibility. And I believe it's my responsibility as a healthcare provider to help give them the tips and tools that'll prevent them from relapsing or developing a problem with their prescription pain medication. Thank you.